This video is on celiac disease. Celiac disease is more commonly known as gluten intolerance and is an autoimmune process. As shown in this diagram, it's the small intestine that's infected. On the left you see normal intestine with normal villi protruding outwards to help absorption. But in celiac disease, the villi is damaged and flattened, hence absorption is impaired, specifically of gluten, and that leads to gluten intolerance. Presentation is commonly due to chronic recurring diarrhea, but there is no blood or no hematochezia, and chronic diarrhea usually being over 2 weeks. If it's less than 2 weeks, you'll be more likely to think of an infective cause. The patient may also have abdominal distension on examination, and they may also report pain. There are also extraintestinal manifestations of celiac disease. These often relate to nutritional deficiencies and subsequent signs and symptoms. So they may have malabsorption and hence failure to thrive. They can have steatorrhea, so floaty white stools, growth failure related to malabsorption, as well as hypocalcemia, iron deficiency, IBD, and rheumatoid arthritis, given the similar autoimmune picture. With hypocalcemia, it's important to monitor ECG changes, as long QT can lead to a fatal ventricular fibrillation. Investigations must be done after a gluten-free diet. The most important diagnostic investigation are serological testing, because it's an autoimmune process. You're testing the antibodies against basically the villi. So the main ones are tissue transglutaminase, EMA, IgA, DPG, and anti-gliadin antibodies. You also want to rule out differentials, so do a stool MCS, overcysts and parasites, as well as look for extraintestinal complications or symptoms. So first blood count and iron studies looking for any iron deficiency, LFTs, UEC, CMPs, looking for hypocalcemia, as well as B12 and folate, as they can also be malabsorbed, leading to B12 and folate deficiencies. But this is more likely if it's been going on for 3+ years, as B12 and folate can be stored, so may not result in a peripheral neuropathy. Management is logically to avoid gluten food products. So no wheat, no rye, no barley. And at the start, it's also important to avoid any dairy products, because there's commonly also secondary lactose intolerance. It's also important to treat any underlying nutritional deficiencies, such as B12, folate, and iron. Long-term management focuses on the risk of comorbidities, as patients with celiac disease are at an increased risk of non-Hodgkin lymphoma. It is also important to monitor celiac serology every 6 months, assuming they are on a gluten-free diet. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.